The problem of counterfeit drugs is a global one, not one which is peculiar to any nation. However, some have it worse than others. Some countries, like the Democratic Republic of Congo, are making moves, however, to make such challenges a thing of the past. Take Bukavu in eastern DRC, for instance. The community faces the challenge of drugs that are either fake, sold without a prescription, or administered by an unqualified person. And that trend is growing. The World Health Organization estimates that 10% of prescription drugs available in pharmacies and hospitals around the world are fake. Now, here in Africa, or the rest of Africa, I beg your pardon, anywhere between 30 and 50% of prescribed drugs are fake. Children are estimated to die from such administration of fake drugs per minute. Congo authorities say that the problem is made worse in the vast and unstable east, where frequent conflicts have displaced hundreds of thousands of people and also destabilized the region's economy. Now, there are a few countries that have top records with fake drugs. Uganda is one of them. So is Tanzania, Nigeria, and Congo. And we remember that the National Agency for Food, Drug Administration and Control has been waging a war against fake drugs in the country. Remember, that war took a more serious turn in the past few years. In the past, less than 5 years ago, that war became more serious. I have with me in the studio the Director General of NAFDAG, Mr. Orhii. You're welcome to Network Africa.
Thank you very
Mr.
much.
Paul Orhii. Sorry for forgetting your name for a second there. Thank you for joining us on the program.
Thank you, Marushi.
How bad is it, Nigeria's record with fake drugs? Is that still a main issue for us?
Fake drugs have remained a main issue and might continue to remain a main issue for some time. But in Nigeria, we have recorded some success. Generally, the global picture of fake drugs has grown worse over the past few years. With the crackdown on illicit narcotic trade, former drug barons have now resorted to manufacturing and distribution of fake drugs globally. So the global market value, the value of fake drugs globally now constitutes about between $75 billion to $200 billion annually. And of course, with that, because this fake drug distribution is less risky, most jurisdictions do not even have a law against fake drugs, and of course, very lucrative business. With the entrance of the former drug barons, the business has become more globalized and more sophisticated and more militarized.
Yep, sorry, but in Nigeria, it seems like, we're receiving, not like we're actually exporting these fake drugs.
Yeah, fake drugs target Nigeria, selectively target Nigeria for so many reasons. First and foremost, we have a huge population, more than 170 million people. Then we have a huge disease burden. If you look at malaria alone, more than 300,000 visits to a physician in a year in Nigeria are due to malaria. Nigeria has, let's say Sub-Saharan Africa has about 1/4 of the world disease burden of malaria, and Nigeria alone has 1/4 of that 1/4. So it is a big problem, and that is why, and then we had, for a long time, we have had low local manufacturing capacity. We do not manufacture most of what we need. And so we import. And then add to that the vast and porous borders that are very difficult to monitor. That is why fake drugs want to come to Nigeria, because the market is huge. We have made efforts to now try to stop fake drugs. With the recent changes, sophistication of the fake drug dealers, the packaging is so good that sometimes not even the most sophisticated pharmaceutical security expert can tell by looking at the packaging that this one is fake and this one is genuine.
And that's a major challenge, isn't it?
It is a major challenge, but in Nigeria we have made major successes. In fact, Nigeria now is the leader, the global leader in the fight against counterfeit medicines. We are the global leader in the use of cutting-edge technologies because the only way you can detect fake drugs now is use technology. And in the past, we used to rely on the laboratory. It takes months sometimes to detect the medicines. But now we have mini labs. That is what the Congo has just introduced. The mini lab, they are the advisor to the Prime Minister of, the President of Congo, Marie-Francaise Prohens just received a mini lab, but we have been using mini lab here for more than 5 years now.
Is there some kind of collaboration between, you know, West African countries or African countries when it comes to clamping down on things like this? Is there, do you have regular meetings where you meet other, you know, directors of agencies such as NAFDAC in other countries, and you discuss the sort of challenges that you face and solutions to these problems?
We have tried to build such groups so that we can meet regularly, because we realize that fighting fake drugs alone in Nigeria is not that effective, because you have to think globally to be effective locally. Yeah. For example, fake drugs is like a balloon filled with water. If you push it on one side, it budges and can wait in a neighboring country for some time, and then when you relax, it can bounce back even stronger. So we are working with neighboring countries. In fact, right now, the government of Ethiopia, the Ethiopian Medicine Regulatory Agency, has requested to come for training to NAFDAC. Uganda has come. Cameroon has come to partner with us for training. So we're working with other countries. At the international level, we had just in 2012 a new mechanism under the WHO made up of 193 countries, the member states, what we call the Substandard Spurious Falsified Counterfeit Medical Products Anti-Counterfeiting Task Force was started at the WHO. And luckily, Nigeria was made the first chairman based on our effort in fighting counterfeit medicines. The history of counterfeit medicine in Nigeria has been very bad. In 2001, we found out that more than 40% of medicines circulating in Nigeria were substandard or counterfeits. With the efforts of my predecessor, the late Professor Kunyili, by 2005, we were able to reduce the incidence of counterfeit medicines to just about 16.7%. That was a huge achievement.
Yes, it was.
But while we were celebrating that feat, and a study done in 2008 to evaluate the quality of anti-malaria drugs circulating in 14 African countries, including Nigeria, showed that at that time we had a worst-case scenario. More than 64% of anti-malaria drugs circulating in Nigeria were either fake or substandard. We started the effort. When I came, we started building collaboration with other security agencies, the Nigeria Customs Service, the Nigeria Police, the media. We engaged the media, the entertainment industry. And by 2012, we were able to reduce the incidence of fake counterfeit anti-malaria drugs to about 20%, as announced by the WHO.
Okay.
We celebrated that as a feat. But then we introduced the mobile authentication service, a tool that allows the Nigerian consumer, more than 100 million Nigerian users of cell phones, to be able to scratch, text, or authenticate the medicines and reject counterfeits.
Yeah, that's the code that is on Medicare tablets and so on the packets. So you scratch that and you text a number to a certain NAFDAC
short code.
Yeah, short code.
And then you get a response telling you whether the medicine is fake or genuine. Between 2012 to now, an evaluation was done again, and it was shown that we have been able to reduce counterfeit anti-malaria drugs to just about 3.6%. From 64% in 2008 to 20% in 2012 to 3.6%. So you can see a progressive decline in counterfeit anti-malaria drugs in Nigeria. But while the global market is increasing, the counterfeits are included in the global market. But
there is still more to be done.
There's a lot more to be done. One of the biggest challenges we still face is the open drug markets. There's nowhere else in the world that you see drugs sold in open markets as any other commodity. Yes. Then the chaotic drug distribution system. The Ministry of Health has come up with guidelines to stop that. What remains to be done is the infrastructure. The warehouses are not yet there so that we can start full implementation. But we hope that by the time we start implementing and by the time we create enough public awareness for members of the public to know that they can scratch, text, authenticate their medicines and reject counterfeits, I think counterfeit medicine could be reduced to the barest minimum in Nigeria.
Yeah, it could be reduced, but you know, this doesn't actually follow for all sorts of drugs. You still find people on the streets who are still, you know, there's fake pharmacists who are still selling drugs on the streets. People are still patronizing them. I don't understand. Is it that Nigerians are more, they consider, they don't consider the value of their health more than they consider, you know, the amount of money that they spend on their health, because they think it's a lot cheaper buying from roadside pharmacists than actually walking into a hospital, getting properly tested and diagnosed, and then receiving proper medication that you're sure of?
You know, there's a problem of poverty and ignorance too. It's a combination of both poverty and ignorance. And apart from that, you know, sometimes when we say a medicine has failed in Nigeria, it's not necessarily the medicine. Sometimes the diagnosis is not the right diagnosis. Somebody who thinks he has malaria without testing whether they have malaria, and malaria symptoms are similar with symptoms of other infectious diseases.
Yes.
He just buys anti-malaria drugs, self-medicates, and when they don't work, he says, oh, it's a fake medicine.
And it always begins with a fever, so you're confused.
Sometimes it's just any fever, Nigerian will say it's malaria, he has malaria, and start taking anti-malaria drugs.
Okay, go on, sorry.
Well, so there are many, but all this issue of people, you know that even if it is good medicine, by the time it's being hawked or on a tray, open tray, exposed to all sorts of weather and climate, of how it's a chemical, it reacts and can become very dangerous. And of course, look at the person selling it. Sometimes the person has not even finished primary school, and he's multitasking. He's a pharmacist, a medical doctor, both prescribing, dispensing, and then administering the medicine. He's a nurse, a pharmacist, and a medical doctor at the same time. Person who has not finished primary school. So anybody who is patronizing those kind of people should obviously know that they are running the risk, because your medicine may look to be cheap, but you might actually kill yourself with by taking this medicine that has become poisonous.
And unfortunately, there have been a number of deaths resulting from people who patronize these roadside doctors and pharmacists. Thank you so much, Dr. Orhii, for making our time to be with us on Network Africa. Really appreciate your time and, of course, your input into the program. I've been speaking with the Director General of NAFDAC, Dr. Orhii, who has been with us in the studios discussing NAFDAC's efforts at curbing fake drugs and their efforts at relating with other African countries in the fight against fake drugs.